Let's talk about those frustrating, confusing, and sometimes just plain annoying urinary symptoms. A lot of us deal with them. But what if the way we've been thinking about them is, well, all wrong? Today, we're going to pull back the curtain and demystify what's really going on inside your body.
We've all heard this, right? Or, hey, maybe we've even said it ourselves. It's the super common assumption that, these issues are just something you have to put up with as you age. We kind of just accept it and move on, but we rarely stop to question it. So is it really just getting older? Or is there something more specific, something mechanical going on? That's what we're going to dig into. We're going to uncover the why behind the symptoms. And it all really boils down to a pretty simple concept. There's a block in the system. And the main character in this whole story? It's your bladder. Now, the fancy clinical term for this is bladder outlet obstruction, or BOO for short. And honestly, it's exactly what it sounds like. Something, anything, is making it harder for urine to get out. It's not some mysterious disease. It's a physical plumbing problem. And this, right here, is a single messed way to picture it. Imagine you're trying to water your plants, but somebody is standing on the garden hose. All that water pressure builds up behind the kink, right? And what comes out the other end is just a weak, kind of sputtering trickle. I want you to hold on to that image, because it's going to make everything else fall into place. Okay, and here's where things get really interesting. It turns out your symptoms aren't just one big random list of annoyances. Nope. They actually fall into two very different categories, and each one has a totally different cause. Understanding the split is the key to everything. So, on one side, you've got what we call voiding symptoms. Think of these as the direct result of that kink in the hose. It's the physical struggle to get the urine out. Then, on the other side, you have storage symptoms, and these are a completely different beast. They're the side effects of your bladder muscle having to work way, way too hard against that blockage for a long time. Let's break them down. All right, first up, let's talk about those voiding symptoms. These are all about the difficulty of emptying the bladder, and they make perfect sense when you're picturing that kinked hose. You know that feeling, right? You feel like you've got to go, you're all ready, and then nothing. Just for a few seconds. That's hesitancy. What's happening is your bladder muscle is having to build up a ton of extra pressure just to force the urine past that blockage. This one's the most obvious one. It goes right back to that kinked hose. The opening is narrower, so the stream just doesn't have the force it used to. The flow is weak. Simple as that. And this is what happens when your bladder muscle literally gets tired in the middle of the job. It pushes really hard, gets fatigued, stops for a second to recover, and then starts pushing again. It's a classic sign of a muscle that's really struggling. And after all that stopping and starting and straining, you might walk away and still have that nagging feeling like, I don't think I'm quite done here. And that's because you're probably right. The bladder just couldn't keep up the force long enough to push everything out past the obstruction. Okay, now for the second category. And remember, these symptoms are not caused by the blockage itself. They're caused by how the bladder changes after months or years of fighting against it. This is where the long-term effects really show up. Think about it like this. When you work out any muscle at the gym, what happens? It gets bigger and thicker, right? Well, the exact same thing happens to the wall of your bladder. But here, that thickening, it's called hypertrophy, makes the bladder stiff, less flexible, and that means it just can't hold as much. So it feels full a lot faster, sending you to the bathroom way more often. And nocturia, which is just the fancy word for waking up at night to pee, is the exact same principle. That smaller capacity and that irritable bladder muscle, well, they don't just take the night off. So you get those lovely midnight trips to the bathroom. Oh, and this perfectly shows how the bladder has changed. An overworked, thickened bladder muscle becomes irritable. It loses its ability to just calmly stretch and fill up. Instead, even a little bit of urine can make it freak out, sending this screaming signal to your brain that you have to go right now. So now we understand the two kinds of symptoms, the ones from the blockage and the ones from the bladder's reaction. You might be thinking, okay, got it. If I have severe symptoms, I must have a severe blockage. But, and this is a huge but, this is where the story takes a really critical turn. See, to get a handle on all this, doctors use a standardized questionnaire, like the AUS symptom index. It basically just asks you about all these symptoms we've discussed and has you rate how much they're bothering you. The scores then get grouped into categories. A low score is mild. A high score, say over 20, is considered severe. It's a really useful tool, especially for seeing if things are getting better or worse over time. So that leads us to the million-dollar question, doesn't it? If your symptom score comes back at a 25, that must mean the kink in your hose is really, really bad, right? Wrong. And if you only take one single thing away from this entire explainer, please let it be this. Study after study has shown a very poor correlation between how severe a person's symptoms are and how severe their physical blockage actually is. You can have someone with a sky-high score and only a mild obstruction, and you can have someone with a really bad blockage who's barely bothered at all.
So, what in the world does this all mean for you? It means your symptom score is a measure of how bothered you are, but it does not diagnose a blockage. It means we have to remember the voiding symptoms, the weak stream, those point to the blockage. But the storage symptoms, the frequency and urgency, those point to the bladder's reaction. What you're feeling is just the starting point, it's not the final answer.
Look, understanding where your symptoms are coming from is incredibly empowering. It means you can have a much smarter, more informed conversation with your doctor to find out what's really going on. Your symptoms tell a story, for sure, but they don't reveal the ending. They're just the start. So, the real question is, what will your next chapter be?